This morning on The Blend, we have with us Dr. Colton Prudnick, who is a urologist with the MSU Health Team. Welcome to The Blend.
Good morning, and thanks for having me.
September is National Prostate Cancer Awareness Month, and we hear a lot about the PSA test screening for men. When should men get screened for prostate cancer?
This has been the topic of great debate for the last 5 to 6 years. In general, men between the ages of 55 and 69 should see a physician and have a periodic PSA checked. Occasionally, with associated risk factors, we may want to start that earlier.
Well, who is at risk for prostate cancer?
It's a good question. So men in general are at risk for prostate cancer. 1 in 7 men will develop prostate cancer over the course of their lifetime. There are also some other genetic factors that are involved in that. There's not much clarity on that at this time. However, we do know that families who have fathers or brothers who have developed prostate cancer are at higher risk, about 2 times more likely to develop that, as well as African American men or men with Caribbean descent.
Okay.
There's also been some data suggesting that patients with family members who have had breast or ovarian cancer may be at risk as well.
Interesting. Now, you are a urological surgeon. What services then do you provide?
Sure. So at MSU Urology, we deal with a lot of very sensitive issues and issues that people don't always want to talk about to their friends or primary care physicians. It's our day-to-day. We deal with kidney stones, bladder cancer, kidney cancer, prostate cancer. One of the other things we do is a lot of these sensitive genital issues that people don't always want to discuss, including urinary incontinence, erectile dysfunction, and other sexual health issues.
Okay, so are there any symptoms that as a man I should be aware of that may lead me to go in and get a PSA test for prostate cancer?
One of the issues with prostate cancer is that oftentimes there are no symptoms, which is why we're so keen on getting PSAs every now and then. In terms of what you can develop, it's very similar to enlargement of the prostate, which is an issue that is not cancerous but can be bothersome to men. And those are urinary frequency, urgency, and occasionally you can have some blood in the urine or sensation that you're not emptying your bladder.
Very interesting. Is there one thing you want people to know about urologists?
Yeah, we're here to help. A lot of what we deal with is very sensitive, and it's our day-to-day lives, and so we try to make patients comfortable with that.
We're going to put your information on the screen. There it is. You can get more information by visiting healthteam.msu.edu. Doctor, thanks so much for joining us today.
Thank you.